overcrowding and under-resourced health services. And that was before the coronavirus pandemic struck Canada. First Nations communities are bracing for what will happen if, or rather when, COVID-19 reaches their doors. Vivid in their minds is the memory of the swine flu outbreak in 2009, when Manitoba chiefs requested medical supplies from Ottawa and received a shipment of body bags. Some First Nations have declared their own states of emergency and are banning outsiders from entering to prevent COVID-19 from infecting their communities. But it is impossible to capture the full picture of Indigenous health in Canada without looking at Indigenous communities in our major cities and towns, which are all too often overlooked. More than 60% of Indigenous people in Canada live off reserve. Many urban Indigenous organizations worry the people they serve are particularly vulnerable to COVID-19 and could fall through the cracks. Leslie Varley is the Executive Director of the British Columbia Association of Aboriginal Friendship Centres. This is a network of 25 centres that provides crucial social services to urban Indigenous people. Their programs relate to everything from culture, sports, and language to health, violence prevention, and employment services. Leslie Varley this morning is in Vancouver. Hi there. Welcome to the program.
Hello, Michael. Thanks for having me.
Not at all. It's great to have you with us. What do you think about how the coronavirus pandemic could affect Indigenous people living in towns and cities? Because when we think of First Nations people, we think about reserves, I think, across the country. What are your biggest concerns?
That's true. The federal government certainly has put a lot of thought into reserves, but we do have a lot of Indigenous people living in urban centres, particularly in British Columbia, where our number is 85%. You mentioned 60% nationwide. In BC, it's 85%. At least that's the number that we can agree on. We think it's higher. So we have some pretty serious concerns about COVID and how it's impacting us. We have issues around food insecurity. It's a huge crisis for us right now. Violence against women and children and elders. Those are concerns for us. Homelessness is a huge concern for us because we're finding that people don't want to be dealing with the homeless population right now. Women's safety, elder isolation is another big area for us that we're worried about as well. And we're trying to figure out how we can not only get food to our elders, but keep their mental spirits high.
Yeah. So in ordinary times, getting health programs to urban Indigenous people, it's difficult enough. The pandemic must complicate your lives incredibly.
It's quite complicated for sure. We have 1,000 workers across, or over 1,000 across our friendship centers, and a lot of our workers are afraid. We've been really lucky because we've had the provincial health office, we've had teleconferences weekly with them, trying to understand how transmission occurs, and we're feeling quite safe to ask any question at all to the provincial health officer about transmission and about, the projections for the illness. But one of the real concerns that we have is that the provincial health office is not telling us where, except for inside Vancouver in long-term care facilities, they're not telling us where the transmissions have occurred in community, so we don't know. We know vaguely general numbers, but particularly in communities where we have work camps, like the hydro dam is still being built in northern BC, and people are still flying, construction is still going on, and people from out of town are still coming into those communities. We know transmission is occurring there, but we're not being told, and people are very afraid, and they're not sure if they're taking enough precautions.
Leslie, tell me about the funding that you have and the funding you need. The federal government's responsible for funding health services on reserves. Is that right?
Yes.
Who's ultimately accountable for health and well-being of urban Indigenous people?
Well, that's down to the province. In BC, again, we have a bit of a difference. We have a First Nations Health Authority now. it wants to serve what it calls its people away from home. So those are First Nations people who are living off reserve. And so we kind of are in between this, where we have a lot of people who are off reserve, and we just use the regular provincial system. There are a few health services that we provide and offer. Most of those are prevention services. There's very few primary care services that are off reserve for Indigenous people. So we're in this sort of uncomfortable place where we'd like to provide primary care and prevention services to our folks, but the funding isn't there for it.
Tell me what a friendship center is. What kinds of services do you provide?
Sure. Friendship centers have been around since the late 1960s, and one of our elders, Marjorie White, was one of the people who created one of the first friendship centers in Vancouver, and I think it was in 1968 or 69. And it was addressing the people coming out of the residential schools and deciding to move into urban communities rather than moving home to their communities. And so it started as a form of friendship, and we've held on to that name where people were connecting with each other. And since then, we've evolved into service centers, and it's an integrated service model, an Indigenous model. It includes everything. Children and family services is a big part of what we do. Employment and training, health services, counseling, mental health services, housing and shelter services are another big piece of what we do. Transition support services, shelters for many of our friendship centers now have daycares, child development programs, and of course, language and culture revitalization has long been the founding piece of friendship centers. A lot of people who were scooped in the 1960s started coming to friendship centers looking to reconnect with Indigenous culture and language, and so that's always been a big piece of what we do.
Do your volunteers or your staff have access to the appropriate number of healthcare workers, the paramedics, the doctors, the nurses, or is there an ongoing shortage?
There's an ongoing shortage right now. In fact, it's a scramble for all of us to find even the right equipment to be able to be providing the services that we're providing right now. So for shelter services, it's almost impossible to get masks and gloves and the equipment, shields maybe that we need, and cleaning supplies that we need to even provide those services to keep ourselves safe and to keep our community members safe. So it's really difficult right now.
You know that some Manitoba First Nation chiefs have asked Ottawa to help bring in Cuban doctors to help on reserves. I'm wondering if there's some kind of program that would give you more human and mechanical resources for the off reserve people.
That would be wonderful. I'd love to have some Cuban doctors working in our communities. We're stretched in BC with doctors as a whole. I personally don't have a regular doctor. I go to a walk-in clinic and try to see that doctor that works, one specific doctor that works there, and that's been for years. And many of us don't have regular doctors in BC, and a lot of Indigenous people end up going into a medical crisis, and we end up going into emergency, even for big issues like cancer and diabetes and heart disease. We actually get those diagnoses in the emergency room, and it's a terrible way to have a healthcare system. And right now, during this COVID crisis, we're being encouraged to stay away from hospitals because they want to secure every bed for this crisis. So yeah, we're really concerned for our people.
I want to go back to something you said earlier. You were talking about the danger to your individual staff and volunteers and so on. Have you had people say to you, look, I can't do this anymore because I don't want to infect myself or my family?
Oh, absolutely. Our workers who are working for us, first of all, they're working for minimum wage or slightly more. And for example, one worker he's 60 years old, he has a wife at home who's got cancer. And so her immune system is compromised. he is in the age range where he is at risk himself, and he's afraid to come to work. He wants to come to work. He needs the money, but he's afraid of passing on COVID-19 to his wife and bringing it into his home. So some of our workers are, have these genuine fears, and we're trying to find the balance of bringing people into work, but also keeping them safe themselves. And a lot of our people, have chronic diseases, and so we have other, health factors to consider.
When we talk about the vulnerable, the marginalized, I would think that in your orbit, perhaps the most vulnerable would be Indigenous women. Is that right?
Yes.
I'm just wondering how the pandemic is affecting them in terms of their own health, the health of their children, endangered pregnancies, whatever, and of course, violence.
Violence is a huge issue, and of course, it's often women that are trying to provide the food security. And as you know, we have the Highway of Tears here in BC, and we're seeing on social media that women are saying, to heck with it, I'm going to hitchhike into Smithers or Terrace because we need groceries, we need to go to the drugstore, we need things. And the transportation along that corridor has improved very little, since the report came out. And the Friendship Centers have got together and run a bus from Prince Rupert to Terrace to Smithers. Those runs are often not convenient, and that's it's 4 or 5 hours drive each way. They can't possibly meet the needs that's out there. So that's a real concern for us, that women are getting back onto the highway and hitchhiking. And we know from the reports that have come out around violence against women, and Indigenous women in particular, that nothing has changed. So women's safety is a huge issue for us. We have very little services within our Indigenous community. And part of the problem that we still have in Canada is, of course, Indigenous specific racism. So we know, for example, that there are over 200 mainstream ending violence programs in transition houses in BC. Only about a dozen of those are Indigenous. And we have some really minor, small prevention programs within our centers, but the money and the supports and the funding for that exist outside of our community. And people are very unlikely to go. If you've got a community like Hazelton, for example, where it is 85% Indigenous, and yet the 15% of the population there are providing and running, a lot of the services that Indigenous women won't access because there's cultural differences, there's racism, we don't feel welcome, it doesn't feel culturally safe and inclusive, and we feel we are still being negatively stereotyped. So this is a huge issue for us now, because it's at a crisis level for us now, because we're not accessing those services. We don't have any services of our own. And we know that because of social isolation that's happening, and we're all stuck in our households. You're in your home, I'm in my home, I've got 3 other people in this house, and we're kind of getting tired of looking at each other. So where we've got trauma in our communities from ongoing and historical colonial violence, that acts out inside the household too. And so we know that women are experiencing this, and they don't have any choices right now. There isn't anywhere for them to go.
But isn't there something, is there something that the province can do to alleviate this situation, which has gone on, as you said, for decades?
Well, I mean, specifically around this issue yet?
The violence.
No, nothing really. I mean, I've been starting to raise it with the province, saying we have never had this opportunity to provide these services to our own people. All these kinds of services have existed outside of our community, and it's time to transfer them. We know our community so well. We know who the violent folks are and the perpetrators are, and we know specifically what kind of services are needed, and it's a different kind of service. When we're dealing with colonial trauma, we need to be addressing colonial trauma in our services.
That is Leslie Varley. She is Executive Director of the BC Association of Aboriginal Friendship Centers, and this morning she's speaking to me from Vancouver. What do you want to see happen next? Is there a feeling that you're going to get the support you need? Give me a bit of a shopping list. What are your communities most crucial needs at the moment?
We need staffing. I mean, keeping our child care centers, our daycares open is a challenge in and of itself right now. We do need volunteers. We need people to help us with that. We need anti-violence funding. We need to be able to, what I would love to be able to do is to both buy food and drop it off to our urban community members and make sure that they've got an ability to buy food. The counseling services, talking to my friends working at Battered Women Support Services, their request for services is just going crazy. It's huge, huge work for them right now. We'd love to be able to provide those counseling services to our own Indigenous women and children. Elder abuse, we'd love to be able to provide some supports for that. We'd like to get some shopping, just grocery cards out so that people can actually get out there and see what there is left to buy in the grocery stores. I'm sure they're stocking up again and being able to go and buy and select their own food instead of, us sending them things maybe that they don't want to eat. So yeah, my shopping list is to get food. Food insecurity is huge right now. It's getting more travel supports on the roads where we know it's dangerous. Homelessness and near homeless people, being able to provide supports for them. And they also don't have anywhere to go, where they used to go and sit down and have a meal together. They're not. They're lining up, they're taking a bag lunch, and they don't really have anywhere to go. The city is trying to get homeless folks to self-isolate if they're sick or to, keep the social distance. And it's just unrealistic, trying to find places for them to go and be comfortable. Some of our friendship centers are providing emergency shelter supports. And even though we're being supported with, hazard pay to provide that, it's still hard to find. It's kind of tragic watching that population of all populations, the homeless population, and it's a great deal of Indigenous people. I think we're all having our moment of humanity and going like, oh my God, look what we're doing. Like, look what we're doing for our homeless people. Why don't they have a decent, safe place to go? So the top of my shopping list would be housing for all of our homeless.
Given the fact that you and your staff are stretched almost to the breaking point, to the limit, how long can you carry on like this? How long, Leslie, can you go on serving these people?
Yeah, that's a good question. I know we're going to try to gather to talk about some of our employment issues because, as I said, some of our staff don't want to put themselves on the front line of this disease and risk catching it themselves and bringing it home to their, family members. So we're self-isolating. Many of us are trying to work from home, and that's been a difficult thing. I think one of the biggest challenges, heartbreaking thing for us is that we provide this big annual conference every year for Indigenous youth, and it's called Gathering Our Voices. This year it was for 1,200 youth, and it's in Kamloops. And these kids are from 14 to 18 years old. They look forward to it all year. They fundraise to come, and we put everything possible in front of them to expose these youth to all of their future life possibilities: employment, entertainment, culture and youth, education. Almost all the colleges and universities in BC are there trying to recruit these youth. We have 3 days of this, and a lot of the Indigenous children in care, this is their one connection back to Indigenous community where they come. So the first thing that we had to do was cancel that, and that was just heartbreaking to have to cancel that Gathering Our Voices conference for 1,200 youth. And we've got, all kinds of funding. It cost us $1 million to put that conference on for 1,200 youth. And how are we going to fundraise for it next year and get the youth back to the one big thing that is a big deal for the youth here in BC, and they love this.
Thank you very much for talking to us this morning. I can't imagine the workload that you must have day to day, night to night, working with probably among the most vulnerable people in our society, and we have to look after them. Thank you very much, Leslie.
Thank you, Michael.
Leslie Varley is the Executive Director of the BC Association of Aboriginal Friendship Centres. This morning she was in Vancouver. This is the Sunday edition across Canada on CBC Radio 1 and across the United States on Sirius XM Radio, channel 169. My name is Michael Enright. New music now from Willie Nelson, who will release his 70th album the day before his 87th, that is 87th birthday on April 29th. The first single is Time for the Season. It's called First Rose of Spring. The first time that he saw her, he knew everything had changed. Overnight, love started blooming like the first rose of spring. Auburn hair like the sunrise, sweetest smile he'd ever seen. Butterflies, they dance around her like the first rose of spring. Summertime would have never started. Wintertime would never end. She colored his life, opened his eyes to things he never dreamed. Without the first rose of spring. Giving children like a garden, and gave them all the love they need. Grew up strong, she made a home every year he'd bring her the first rose of spring. The last time he saw her, he knew everything had changed. He said goodbye and let the tears fall like rain. On the first rose of spring. That was the unstoppable Willie Nelson with his 70th album of his career. The song was First Rose of Spring. That is all the time we have for the second hour of the Sunday edition. Governments around the world and here in Canada are preparing to send out billions of dollars to people who've lost income because of the COVID-19 pandemic. It has made some people wonder why we don't just adopt a universal basic income to help everyone ride out hard times, anytime. Former Conservative Senator Hugh Segal has been arguing for a universal basic income for years, and he'll be here to make his case in our next hour. We'll be back right after all the latest news and latest weathers. That's Angela Hewitt, by the way. Marvelous. I'm Michael Enright. Don't go away.
This is CBC Radio 1, 88.3 FM in Fort St. John. He thought his phone would blow up. That was the shocked reaction of Dr. Isaac Bogosh when he heard President Trump tout an anti-malaria drug for treating the coronavirus.
Knew that every single person who is an infectious disease provider on the planet is going to get about 1 trillion questions.
Hype or Hope on White Coat Black Art with Dr. Brian Goldman. Tonight at 6:30, 7:30 Atlantic, 8 in Newfoundland, and on the CBC Listen app. Bill Morneau's $107 billion aid package has passed, but is it enough? A labor lawyer, a doctor, and an economist will answer your concerns. How has COVID-19 disrupted your job? Join Doug McHugh for a Q&A special this afternoon on Cross Country Checkup.
This is CBC News. It's sunny and 10 degrees in Greater Victoria and snowing and minus 16 in Fort Nelson. Hello, I'm Brian Dancing, Vancouver. Prime Minister Justin Trudeau announced more funding for charities that help seniors and children affected by COVID-19, but there are many more groups who say they too are in dire need of the government's support. Catherine Cullen has more.
I know these past weeks have been tough.
For kids worried about all the change they're dealing with, and seniors who might feel isolated or need help getting groceries, the Prime Minister today promised relief.
Whomever you are, whatever you need, we're here for you.
He announced $7.5 million for Kids Health Phone and another $9 million for the United Way directed at programs that help seniors.
But we recognize there's much more to do.
In a joint letter sent out Wednesday, 140 charities said they needed the government to set up a $10 billion fund. They warned more people in need and fewer volunteers could lead the sector to irreparable collapse. Trudeau said today he'll have an announcement to deal with charities more broadly in the coming days. For now, he's asking Canadians who can volunteer or donate to do what they can to help. Catherine Cullen, CBC News, Ottawa.
BC government is providing $3 million from the Community Gaming Grants program to food banks. Food Banks BC will distribute the money among food banks province-wide to buy and distribute food, pay employees, and cover other costs essential to the delivery of their food programs. The $3 million grant uses funding that remained in the Community Gaming Grants 2019-20 budget of nearly $150 million. There's more hope for 248 Canadians stuck on board a cruise ship off Panama's Pacific coast. Up to now, the ship has been denied passage through the Panama Canal because of a coronavirus outbreak on board, but that's changed. Laura McQuillan explained.
The Zandam is now headed for Fort Lauderdale, Florida, though officials there are yet to confirm it will be able to dock, with some of them expressing concern about the pressure that the sick passengers and crew would place on the local health system. Now, all of this comes after 4 people died on board the cruise liner, which was carrying some 1,800 passengers and crew. More than 130 of them have flu-like symptoms. Yesterday, hundreds of people without symptoms were transferred to one of Holland America's other ships, and both ships have now been granted passage through the Panama Canal on humanitarian grounds. And though it's unclear exactly where the Zandam might finally dock, we know the federal government here is working with the government of Panama and the cruise line to get those Canadians on board home. Laura McQuillan, CBC News, Toronto.
U.S. President Donald Trump has backed down on imposing a quarantine on 3 states that are the U.S. hotspots for the coronavirus. He raised the idea as the number of COVID-19 infections and deaths continues to soar in the U.S. Katie Simpson has more.
The president publicly floated the idea of issuing quarantine orders for New York, Connecticut, and New Jersey, where the spread has been very intense and overwhelming. Around midday yesterday, Donald Trump told reporters he was considering the measure, but by the end of the day, he had backed off. Instead, the Centers for Disease Control has issued a travel warning that asks people to avoid all non-essential domestic travel for 14 days for those regions. There's a real fear among state leaders that travelers, or basically anyone that goes to New York specifically, that the infection rate is so high there, they're afraid that they'll catch it and spread the virus. For example, in Rhode Island, state troopers are stopping anyone with New York license plates to collect information about those people to ensure they are self-quarantining. Trump still has to make a decision, likely by Monday, about whether to extend his physical distancing guidelines for the entire country. Katie Simpson, CBC News, Washington.
And health officials in the Netherlands have issued a recall for protective face masks imported from China. Dutch authorities say the masks failed safety tests and were found to have defective filters. The recall affects nearly half of a shipment of over 1 million masks. Given the Dutch hospital, nearly 10,000 cases of COVID-19 have been reported in the Netherlands, including 640 deaths. And that is the CBC News. Having a look at the BC weather for the South Coast, a mix of sun and cloud this afternoon with a high of 12 degrees. Elsewhere in the province, southern interior, a chance of showers, windy and a high of 9 to 13 degrees, a mix of sun and cloud in the South Thompson. Central interior, chance of showers and flurries, highs near 3 degrees. The Peace region in the north, snow or flurries, highs minus 14 to minus 10 degrees. In the north coast, a chance of showers. This is the Sunday edition, our third hour for March 29th, 2020. I'm Michael Enright. Brian Bilston, now that's not his real name, but he has been hailed as the poet laureate of Twitter and the Banksy of poetry. His couplets are full of wit and drollery, and he has a gift for capturing any kind of occasion in verse, even a pandemic. We'll revisit my conversation from last fall with the man behind the pseudonym, and hear his poetry about these very strange and unsettling times. But first, a longtime conservative insider makes his pitch for a massive social program, a universal basic income. Throughout the COVID-19 crisis, the Canadian government has been assuring us that, compared to the rest of the world, Canada is among the best prepared to deal with the looming global financial crisis. And the government tells us everyone who has been put in financial jeopardy by the pandemic will be provided government help to make sure they can buy groceries and other necessities and pay the rent. Canada has in many ways been at the forefront of social policy. We have had the old age pension since 1927 and Medicare since 1962. So, if this is one of the richest countries in the world, why does it take a global crisis to force governments to promise that every citizen will have at least a subsistence income? Prior to the COVID-19 pandemic, a growing number of economists and governments have been taking universal basic income seriously as a way of addressing poverty. Now that the pandemic and its economic consequences are upon us, conversations about universal basic income are getting amped up. Hugh Segal has been advocating for a guaranteed annual income for decades, in part because of his own experience growing up poor in Canada. In his latest book, Bootstraps Need Boots, One Tory's Lonely Fight to End Poverty in Canada, he puts his campaign into historical perspective. He is a former Conservative senator and a backroom political operative. He was Chief of Staff to Ontario Premier Bill Davis and later to Prime Minister Brian Mulroney. He helped design the Ontario Basic Income Pilot for Kathleen Wynne's government in 2016, which was later scrapped by the Doug Ford government. Hugh Segal is Matthews Fellow in Global Public Policy at Queen's University's School of Policy Studies. Now, we recorded this conversation in our Toronto studio shortly before the whole pandemic crisis exploded. He and we had not yet seen how timely his call for guaranteed annual income would be. Hello, sir. Good to be here. This is a memoir as well as a polemic.
When UBC Press was good enough to say to me, we'd like you to do a book, and we'd like you to do it about your own background, I said, well, why would anybody care? And they said, look, you're the only prominent conservative in Canada who's campaigned for a guaranteed annual income, a basic income, for 4 decades.
Since 1982.
Correct.
Yeah.
And most conservatives would think that's a terrible idea. Perhaps if they understood what happened in your life to get you to that conclusion, they would understand why it's a rational thing for you to support. And if that opens the debate and provides for more discussion, that's a worthwhile thing to do. So that's the reason it was written from kind of my 9th birthday up until the present, so as to give folks a sense of how I ended up where I ended up on this issue.
Well, then we can talk about both.
By all means.
All right. Just first of all, though, how would a guaranteed annual income work? Would we get a check every month or from the government, or how would
it would work the same way the guaranteed income supplement works for seniors? Now, it's based on your income. And if you are beneath a certain level, you get topped up automatically. So it doesn't involve more civil servants working in the welfare departments of the provinces. It doesn't involve more bureaucracy. It's done as, call it a negative income tax or a refundable tax credit. People would get a check or an automatic deposit to their account on a monthly basis if they're beneath the poverty line and need to be topped up.
Would it go to everybody? Would it go to the millionaires?
No, this is a top-up, which means that you get topped up between what your income may be now, could be zero, could be $600 a month, to a number of about $1,300 or $1,400 a month, which would get you into about 75% of the poverty rate. But unlike welfare, it would encourage people to work. And if you did work, you could keep a large part of what you earned. Wouldn't be clawed back as it is in all of the provincial welfare systems across the country now. And let's be clear, provincial welfare systems, however well-intentioned and supported by good-hearted and committed public servants, doesn't pay more than 40 or 50% of the poverty rate anywhere in Canada. So it doesn't lift anybody out of poverty. It actually traps people in poverty, because if they try to work or earn a couple $100 a month, it all gets clawed back dollar for dollar. Conrad Black doesn't pay dollar for dollar on his highest level of income. Why would we ask our lowest income Canadians to be paying tax at that level?
There was a report that came out in January from the Basic Income Canada Network.
Yes.
In which they put a price tag on all this. They say it's about $600 billion. Would it cost that much? And could we save that much?
So I look at the numbers that came out from the Parliamentary Budget Officer about 3 years ago, when Pierre Poilievre, who was the finance critic of the Conservatives and was opposed to a basic income, asked them to take the pilot project, which I had designed for the Premier of Ontario at her request, and say, what would this cost Canada if this was actually put into place across the country?
Okay.
And the Parliamentary Budget Officer said it would probably cost about $60 billion, without counting those federal and provincial programs it would replace. Those would produce substantial savings for the taxpayer. That would bring the number down to about $25 billion nationally. That's less than 10% of Canada's total economic costs in terms of running the store. And that would be a very, very efficient investment, not only in reducing poverty, but in reducing all the negative pathologies of poverty, like bad health care, bad health status, bad education outcomes, family difficulties, difficulty with the law, all of which cost taxpayers a tremendous amount of money.
I was surprised to learn that Milton Friedman, the Nobel laureate economist, almost an Ayn Randist, supported the idea of a guaranteed basic annual income.
Michael, there are a lot of people on the right and the left and in the center who support it, but for different reasons. Milton Friedman's position was, I remember when he made this wonderful statement, he said, if you gave the American government responsibility for the Sahara Desert, there would be a sand shortage in 3 years. Give the money to the people. Don't give it to well-meaning civil servants who will decide how people have to live to earn the welfare check every month and meet a whole series of criteria designed by the swells, so to speak.
Sure.
Give it to the low income. They will know how to spend it. They're not going to send it off to some account in the Caymans. They're not going to, they're going to spend it on their day-to-day requirements, which will just recirculate in the economy. And he was right.
How did he square that with his whole emphasis on the market and the free market? And
because his view was
invisible hand.
His view was the less the role of the state in terms of managing how people live, the better normal instincts will operate in a way to produce good outcomes. And his view was Low-income people are no less bright, no less competent to figure out what they need, and they're probably a darn sight better at it than public servants who are being paid not to help people out of poverty, but to manage how they live within the welfare wall that is established around poverty.
Well, that's because no government is going to put this into effect. Everyone talks about it. There was a pilot project, as you alluded to a little while ago, in Ontario.
Yeah.
What happened to that?
Well, despite the commitment of all three parties to wait for the 3 years to see what the results were, the new Ford administration came in and canceled it right away.
That's correct me if I'm wrong, that's a conservative administration.
Well, it's conservative. It's not progressive conservative.
All right.
It doesn't deserve that title. And I think, when Mr. Ford campaigned on I'm for the people, I guess he wasn't for low-income people. He was for other people. And that's fine. He can make that choice, and people can vote however they think appropriate. But the bottom line was he separated himself out from a tradition of progressive conservatives that goes all the way back to Bob Stanfield, goes all the way back to Bill Davis, to others who did things like this, were in favor of things like this because they knew it made the economic tent larger. It gave more people a chance to sit at the family table of the family we call Canada. And if you keep people away from that table, that's when you seed the ground for other more substantial problems.
I want to look at the other elements in the book. I've never wondered why a conservative such as yourself would support a guaranteed annual income. I've wondered why you're a conservative in the first place. Your grandfather, for example, was a union activist.
Yeah.
In the Women's Garment Union.
That's right.
International. Your father drove a cab.
That's right.
In Montreal.
That's correct.
So you did not grow up in the bosom of the wealthy, precisely, did you?
No, I did not.
And why aren't you a member of the CCF as it then was and the NDP as it now is?
Well, probably the emotional reason is because Mr. Diefenbaker came to my school when I was 12 years of age in the 1962 general election. And he made a very populist prairie speech about making sure there's room for everybody around the family table, making sure that we reached out to farmers and to seniors and to new refugees and new immigrants. And don't forget, it was his government, Ellen Fairclough, who changed the immigration system so people had a point score as opposed to who was your father in terms of getting into the country. And of course, he brought to our school the Canadian Bill of Rights, which his government had passed, which was the precursor, if you wish, of the Charter. So that, on an emotional basis, connected me to a different view, a kind of progressive conservative humanity that was not only fundamentally reflective of who the country was, but also spoke to the very best of the human condition.
What would your Zaidi have said about that? You're out there, Diefenbaker, notoriously anti-French, anti-Quebec, and here you are exulting in his appearance when you're 12 years old.
Well, I was 12, and I learned later that as perfect as I thought he was at 12, he may have been not quite so perfect. But when I ran for Parliament in 1972 as a Stanfield progressive conservative, my late grandfather was very much alive, and he said, "You're running for the boss's party." Yeah. And I said to him, I said, "Zeta, look, the bosses in Montreal, in whose garment shops you had to strike to get fair wages, etc., they're all liberals. That's who they all were. They weren't Tories, number one." And then he sent, now this is important, he sent a donation to the New Democratic Party candidate running against me in Ottawa Centre, who was Irving Greenberg, who Minto Construction, one of the wealthiest people in Canada. And he was a very committed New Democrat, as Shirley was, his wife, and good people. But my grandfather would have supported him as a New Democrat. He wouldn't have been negative towards me other than to say, "You're running for the boss's party, right. Man. You're on your own."
How much support do you think the idea of guaranteed annual income has politically in the country and in the population with ordinary Canadians? Because I think a lot of politicians or premiers will put their hand on their breast and say, "I'm in favor of this," and have said so for a long time, and nothing gets done.
So the numbers are clear. When the question is put, and it's put by pollsters every couple of years, you get no less than 73 to 74% Canadians who think it would be a good idea.
Isn't there, though, Hugh, within the conservative movement or within the capital C Conservative Party, the feeling that poverty is somehow a moral failure, that somehow it's a matter of character. If you're poor, you've probably done something or are doing something, or you've sort of deserved it.
So there's a little bit of that, and to which my response is, in a friendly, warm-hearted way, is we had a tiny credit crunch in 08-09.
Indeed.
Where billions were lost,
yeah.
And where governments stepped up to bail out the business community in a whole bunch of substantial ways. And I'm not opposed to them having done that, because there was a liquidity crisis. We had to address it.
Yeah.
So we could find the money to do that without getting into moral judgments about who had taken too much risk or who was being too greedy. When it comes to helping the poorest amongst us, who also have a liquidity problem, well, then we have to come to conclusions about why they are poor. The vast majority of people are poor because of circumstances, frankly, beyond their control.
You take the view, as I understand it, and I infer from the book, is that poverty essentially is a lack of money.
Period. Full stop. It's not a lack of will. It's not a lack of moral decency. It's not a lack of love or affection or citizenship. It's a lack of enough money to pay for transport, clothing, food, and housing in the same month on a consistent basis. That's what it is.
My guest this morning is Hugh Segal, former conservative senator. He's the author most recently of a book called Bootstraps Need Boots, One Tory's Lonely Fight to End Poverty in Canada. We're talking about a guaranteed annual income. We're also talking about your background in Montreal. And you said at one point in the book, being on the cheery edge of poverty is not, as some bootstraps proponents suggest, about building character and ambition. What is the cheery side of poverty?
Well, the cheery side of poverty is when you have loving parents who do their very best to make up for the lack of financial resources any way they can, encourage you to work hard in education, manage to do whatever they can, but you know, because as you grow up, you see it, that they are struggling to pay the rent. Don't forget, these are the days before universal health insurance. These are the days before rent control. These are the days before any of those stabilizers were in place. And I recall, as we sit here this morning, Sunday nights there'd be piles of bills from the drugstore and the grocery store and the butcher shop and rent and the heat and all the rest. And my dad would say, well, let's pick any two piles because that's what we can do this month.
When you saw your father working so hard, he died very young, in his early 50s.
Yeah.
How did that hit you? Not just the death, but the idea of, I don't know, coagulation of dignity, pride, sorrow, that kind of thing.
Michael, my sensation, I think I talk about it in the book, I was just angry because I realized that the things which had taken him down, the illnesses that he had, the fact that he drove a cab and he smoked, I think, 2.5 boxes of Sportsman cigarettes a day, which was horrific, had no time for exercise. All of that contributed to a pathology which took him out at 54. And my view was that was intrinsically unfair.
But you worked very closely with Robert Stanfield.
Yes.
The greatest prime minister the country never had.
Yeah.
And Bill Davis. They seem to understand the need for some kind of social umbrella or safety net or whatever you want to call it. What did they embrace that today's conservatives reject?
When we dealt, for example, with the guaranteed annual income supplement for seniors, that emerged from a minority government circumstance at Queen's Park in 1975, where the opposition parties at a committee of the legislature passed a motion to reduce the salary of the minister, the Honourable Margaret Birch, first female minister in Ontario's history, and Douglas Wright, the deputy minister, that their salary would be reduced to $1, not by $1, because the government wasn't doing enough about seniors' poverty. I was a very young legislative assistant working for Mr. Davis. We had just gone through an election campaign, which we won. It was a close event, but it was a minority. And the issue of seniors' poverty didn't come up in the campaign. Rent control came up, other issues came up, but that did not. So when I was confronted with this, I said, why don't we look into the issue and see what the numbers tell us? And it was Darcy McHugh's ministry, Treasury, Economics, Intergovernmental Affairs, it was called, which did a study very quickly and came back and said, in fact, 35% of seniors in Ontario, i.e. people over the age of 65, the vast majority of whom were women back then, are living beneath the poverty line. 35%. So when that came before cabinet, my expectation as a staffer was that the old right-left divisions, of the McMurphrys and the Grossmans being in favor of doing something and others not so much. But it was Darcy, to his credit, who said, these are the older women who were there during the Depression. They waited for the guys to come home during the war. They are not going to be poor in my Ontario. And that produced the Guaranteed Annual Income Supplement, a statute, a law, passed unanimously in the legislature, which said everybody would get an automatic top-up. And within 3 years, that 35% number came down to under 5%. So we know how to do this. This is not rocket science.
What is holding back various provincial governments in this?
I would say there's a combination of two things. I think they're looking to do this jointly with the feds, because if you look at what happened after Mr. Davis did what he did, that Guaranteed Annual Income Supplement was spread to a few other provinces. Then Ottawa made it the Guaranteed Income Supplement for the whole country. So there is a need, in my judgment, for Ottawa to say to the provinces, those of you who want to reform welfare for the following purposes: increasing the connection to work, reducing the stigma, increasing the health status of people so they live longer, we're prepared to help with that process. And yes, there'll be federal-provincial negotiation, and the plan may look a little different in Quebec than it would look elsewhere. Sure. But that's who we are as a federation. I think there'd be a great will to step forward and do that. In various jurisdictions like Quebec, like Saskatchewan, and under the previous administration, like BC, there's a commission of inquiry in BC right now to look at what a basic income would look like in that province, being chaired by very decent people. And in Prince Edward Island, where I began my political career working for David McDonald, the MP from Prince Edward Island at the time, Egmont, there is now an all-party committee, the Greens, the Red Tories, who are in power in the province, and Liberals, and they are putting together a plan for a province-wide pilot. So I think the idea is very much alive. There's now one of these plans in Stockton, California. There are plans that are going forward in places like Kenya and elsewhere, privately funded. There are tests going on in the Netherlands. There are tests going on in Scotland. So I think people have come to understand that the gap between the very wealthy and the most poor is just too large. And unless we step forward to make that gap smaller, we're going to have other more serious problems, some of which we're going through right now in this country.
There was, back in the 1970s, there was an experiment in Manitoba.
Yes,
Dauphin, Manitoba. Yep. It was called MinCom.
Yes, sir.
How did that work, and what was the outcome?
So it worked this way. It was the Trudeau and Schreier governments that decided to do this. And they decided to do this in part because Mark Lalonde, as the Minister of Health, had taken the position that the notion of dollar-for-dollar financing for everything you spend on health in your province was going to be replaced by grants, legislative grants, based on some numerical assessment of your need, but then you would have to make decisions about how you manage that. And the social determinants of health, about which the science is very clear, made it clear that poverty was a clear contributor to higher health costs. So they set up this pilot project in Dauphin and in other parts of Manitoba, and it was run independently, and basically you had a top-up to a certain level, regardless of whether you worked or not, whether you were employed or unemployed, everybody had a top-up. So it told us a whole bunch of things. During the period of the test, expenditure in Manitoba Health went down by 8%, which is a very substantial amount of money. During the tests, arrests in Dauphin and difficulties with the police were reduced. Labor force engagement, i.e., did people stop working because they were getting the top up? Absolutely not. People showed up to work in the same numbers as they had. There were two groups that didn't show up quite as often. StatsCan called them new mothers, right? Because they could stay home a little bit with their babies. This is before mat leave, by the way. And young unattached males, euphemism for high school students who got to finish high school because the family was financially more secure. And as we sit here today, we know that Should a mother decide to stay home with the child for as long as possible, that's not a bad thing for the child. And we know that if people finish school, they're going to have a better shot at an economically viable life than if they don't finish school. So that's what those results told us very, very clearly.
What happened to it?
Mr. Trudeau went to a G8 meeting about cutting back expenditures, and he came back and did cuts right across the board. And Sterling Lyon was beat Mr. Schreier in the election, and you know how governments don't like to continue the programs of their predecessors because God forbid another party gets credit for something, and that's how it stopped. And it stopped prematurely. It's supposed to be 5 years. It stopped after 3.
Then I go back to the question. We as a society, what does that say about us if we're not prepared or willing to look after what you call the least able? What does that say about us? Look, we've got all this money in the world.
Yeah, Michael, it's about leadership. We would not have had universal health care if Tommy Douglas didn't say enough. We're going to have universal health care. And he fought the doctors and he did it. And then it spread from province to province. Mike Pearson helped that happen. I remember the cycle. The cycle was they brought it in Saskatchewan. Mr. Diefenbaker asked Mr. Justice Hall, formerly of the Supreme Court, to do a study, Emmett Hall. What does it mean for Canada? Hall's report said this is something that is doable nationally. Dief had been defeated in 1963 before that report was brought in. It went to Mike Pearson. To his credit, Mike Pearson put together the system with incentives and other things, so all the provinces went to universal health insurance. And I remember my father standing around embarrassed when the general practitioner came to the house because I had a fever. And a house call was $5. And my dad didn't have $5. And he'd be shuffling around embarrassed. And the GP was embarrassed, and the GP would say, Morris, we'll sort it out later. Don't worry about it. So when that Quebec health card came out and it arrived in our home, my parents opened up the envelope. They were in tears. Yeah. Because they could afford then to go to hospital if they had to, if they could go see a specialist if they needed to, none of which was covered under the previous regime.
About a half a dozen years ago, 4 or 5 years ago, the social minister of something or other of Sweden was invited to Canada, to Ottawa. Yes. And he held talks with his Canadian counterpart. And one of them said, Minister, after we have lunch, I'll take you out and take you to a food bank. And he said, what is a food bank? How come they can do it and we can't?
Because they've made a decision as a society that you measure richness not only through gross domestic product, which is important, but by the degree to which all of our citizens have a chance to participate in the broader world which we're trying to build.
Let me go, perhaps we might end on this, but where do you go from here? You're a missionary. You're on a crusade, if you will.
I believe that Canadians know that our social infrastructure is not meeting the test. So I think it's only a matter of time. And you look at McKinsey as recently as last week issued a report in which they said the gap between rich and poor globally is problematic. And unless we narrow the gap, we're going to have problems with economic growth and productivity, and we're going to have problems with populism that is quite negative and destructive.
And you say in the book it also destroys or erodes any sense of social cohesion.
Well, that's right. And a society has to believe that there are some common values we share. And I happen to think that the vast majority of Canadians believe that people should not be allowed to live in poverty if we have the capacity to lift them out.
Thank you, sir. Thank you for coming in this morning. It's always a delight to talk to you.
Thank you, Michael.
Hugh Segal is Matthews Fellow in Global Public Policy at Queen's University School of Policy Studies. He's a former Conservative senator. His new book is called Bootstraps Need Boots, One Tory's Lonely Fight to End Poverty in Canada. We recorded that conversation in our Toronto studio shortly before the pandemic crisis exploded. Now that we spend most of our waking hours indoors, books can be a portal to another world, or a way to go deeper into ourselves. We've been asking lovers of literature what books they're turning to in this unsettling moment, and why.
My name is Anna Kana Schofield, and I'm talking to you from Vancouver. I'm the author of 3 novels, Bina, Martin John, and Malarkey. I have been following infectious diseases probably for about 10 years. Some people follow tennis, I follow infectious diseases. I don't think of a time of crisis as a time when I would read differently from any other time. Actually, the best way to talk about what I've been reading is to just have a look here on my desk. And on the right-hand side is a stack of books. The first one is Fighting for Life by Dr. S. Josephine Baker, which is an autobiography of a public health crusader. And she describes her life in the New York Lower East Side, during which she dealt with all manner of public health crises and emergencies. And she actually was understood to have saved about 90,000 children's lives. Underneath that is a book called What We Did in Bed, A Horizontal History.